Okay guys, so good morning. So for the second lesson, second module for the Principles of Medical Laboratory Practice 1, it will be about a discussion on uh, the practices of medical technologists or medical laboratory scientist or clinical laboratory scientist and the different career opportunities for this profession. So at the end of this module, students must be able to discuss the practice of medtech as the nature of profession in relation to detection and diagnosis of diseases, and to differentiate the medical technology practice from other laboratory personnel such as laboratory technicians and pathologists alike. So for the term medical technology, it is about the combination of the different products, applications, drugs, reagents, in order to improve the quality of health and care that is delivered to patients, and in most cases, that is the main goal is to extend their lives. And with this, okay, so um, we do not only extend their lives, but it also affects it also affects the health of a nation. Okay, it also affects the health of their families, um and always, and we also help the economy in this way. Okay, so from more accurate and timely diagnosis, precise and complete surgeries, and new alternatives for medicinal treatments, constant innovation in the healthcare field shows no signs of slowing down. Because as you can see, guys, as we go on with the more advanced technology, we discover more or more types of diseases and disorders. Okay, and related to our practice, we need also to innovate. Okay, we also need to conduct more research. We also need to try to improve what technologies we have nowadays. Okay, to find better laboratory alternatives or laboratory procedures. So for the definition of medical technologies, there are actually several, okay, definitions. So, according to Wikipedia, so medical technology is about the diagnostic or therapeutic application of science and technology to improve the management of health conditions. Technologies may encompass any means of identifying the nature of conditions to allow intervention with devices, pharmacological, biological, or other methods to increase lifespan and or improve the quality of life. So, with the definition of Wikipedia, it is about the use of science and technology in order to improve the quality of life, okay, by increasing the lifespan, okay. So, it's actually simple using the products of science and technology. So for the definition of Heinemann, so this is about the application of principles of natural, physical, and biological sciences to the performance of laboratory procedure which aid in the diagnosis and treatment of diseases. So it's almost the same, okay, but it is simpler as compared to the definition of Wikipedia. So this one still is about the application of principles, okay, be that natural, physical, or biological sciences. But in here, unlike in the definition of Wikipedia, it mentioned that it is to increase the lifespan or improve the quality of life. Okay, so um, it is the end goal of the function of the medical technology profession. Okay, unlike in medical technology definition by Heinemann, it is more specific because it's specified here that what we do as medical technologists actually aid, okay, in the diagnosis and treatment of diseases. Okay, so unlike here, that of course, what will happen if our work as medical technologists aid in the diagnosis and treatment of the diseases? Of course, that this one, if this happens, okay, so this is its um, end result, okay. So it increases the lifespan and improve the quality of life. So actually, this is our main focus in the laboratory. Okay, in clinical laboratory, when we are working in a clinical laboratory, because by definition, under the definition of this medical technology, or the different definitions here focuses on the clinical side or the work of the medical technologist in clinical laboratory, which is to aid in the diagnosis and treatment of the diseases. Okay, basing on the result that is given by the medical technologist, these are utilized by doctors in order to aid in the diagnosis as well as treatment. Okay, take note also, guys, that it only aid in the diagnosis. What we do aids in the diagnosis. Okay, so it is not only the main source of information for the diagnosis of diseases. Kumbaga, isa lang siya, it contributes to the diagnosis. But take note that in the diagnosis, it's not just about the laboratory procedures that we do. Okay, so there are also correlation of signs and symptoms, mga ganyan. So, hindi lang purely laboratory. On the definition made by Fagelson, this is a branch of medicine concerned with the performance of laboratory determinations and analysis used in the diagnosis and treatment of disease and maintenance of health. So this one again, this is more specific as compared to the definition of Hiniman, kasi here it specified the use of laboratory procedures. Okay, the laboratory procedures and analysis, so that will aid in the diagnosis. Okay, so that is used in the diagnosis and treatment of diseases as well as in the maintenance of health. In the definition of Hahnemann, it failed to mention this one, maintenance of health. Okay, so it's this one, this is more specific as compared to these two, their definitions. Kasi nga, yun nga, it mentioned or it specified what are done in order to aid in the diagnosis, treatment, and maintenance of health. Okay, that is through the performance of laboratory determinations and analysis. So, by the definition of Walters, medical technology is a health profession concerned with performing laboratory analysis in view of obtaining information necessary in the diagnosis and treatment of disease as well as in the maintenance of health. So it's like a copycat from the fragile zone, okay, from the they call this one from the definition made by the fragile zone. Okay, kasi most of the wordings actually the same. Okay, so here it's a branch of medicine. So we go back to definition of Fagelson. Actually, when you go to med, okay, so most of the subject, professional subject that we tackle are also discussed under the medicine. Okay, so microbiology, parasitology, immunology, um, and many more. Okay, histology, anatomy, and physiology. So those are also okay discussed in medicine. Okay, so here in the definition made by Fagelson, it states that the medical technology is a branch of medicine, but for Walters, this is a health profession, and both are actually correct. Okay, that's why we as the medical technology profession or medical technologists are actually supervised by pathologists, right? And what we do, okay, So this is a branch of medicine kasi our main concern is about the improvement of health, okay? The diagnosis, treatment, and monitoring of health in general. But the thing is, we do not do the diagnosis and treatment, okay? We help in the diagnosis and treatment. So, by the definition of RA 5527 Section 2, okay, so sa saligang batas na to ng Pilipinas, so the medical technology profession is an auxiliary branch of laboratory medicine. So it's specified that our profession is under clinical laboratory diagnostics or laboratory medicine, which deals with the examination of various chemical, microscopic, bacteriologic, and other medical laboratory procedures or technique, which will aid in the physician in the diagnosis, study, and treatment of disease, and in the promotion of health in general. Okay, so actually, this is the end goal of what we do. Okay, even doctors, that is to promote health in general. Okay, promote health in general. But the definition of medical technology under a Republic Act 5527 or the Medical Technology Act of 1969 is that it's specified here that we conduct examination using various chemical because we use different reagents. Okay, we use also microscope. Okay, and we conduct bacteriologic laboratory procedures. We study bacteria and other medical laboratory procedures. Okay, our technique. So the same here, which will aid the physician in the diagnosis, study, and treatment, and promotion of health in general. So it's specified what we do. Okay, so as you can see here, we are medical laboratory technologist, because and as we practice our profession, we use a lot of techniques, we use a lot of materials. We just don't do our profession or our duties as medical technologists on our own. We are helped by different the different products of science and technology. Okay? So, tinutulungan tayo ng mga laboratory procedures, okay? With the help of chemicals, with the help of machines, for us to do our function in the clinical laboratory. Okay? So, what's good with the definition of the RA 5527 of our profession is that it reminds us that we do not do our work on our own. Okay? We are helped by the products of science and technology, and we must always apply it. So it means hindi natin pwedeng hulaan kung ano yung mga resulta. Okay? Kasi kung ano yung resulta ng pasyente, we must conform with the laboratory procedures, okay, of the hospitals that we are working from. Okay? And with that, we must use, okay, we must use laboratory procedures, we must use machines in order to arrive to a laboratory test result. Okay? So, this one generally, so medical technology is generally involved in the use of technology as a means to evaluate health status. Okay? So that is definitely, this is true. We evaluate health status. Okay? But of course, we do not make the diagnosis. It assists in the medical team to deliver quality healthcare through the performance of different laboratory control determinations that provide them the most reliable results for their proper diagnosis and treatment. Okay? So, the definition made by different persons or even the RA, okay, or groups is um almost the same. Okay, so what we do in the laboratory, so for the definition, guys, these are mainly focused on our work as clinical laboratory technologists or medical technologists in the hospitals. But remember that there are different career opportunities for medical technologists. Okay, so always remember that we conduct laboratory tests using laboratory procedures with the help of machines in order to help in the diagnosis and treatment of diseases that will improve the health of the public or a human being. Okay, so we move to the second part of our discussion. It's about a career in the clinical laboratory science, or the different career opportunities that for a medical technologist. Okay, so aside from clinical laboratory things, or working as clinical laboratory scientists, what are other career opportunities that we have? So here, a perfect blend of science, medicine, and biotechnology. So actually, this is true. So for medical technologies, it's about the combinations of science, medicine, and biotechnology. Okay, so how you can join? So here, how can you join an expanding? So actually, that's the proper way, right? How can you join an expanding field with multiple and flexible career opportunities? So we will also uh, discuss how can you be a medical detective to investigate and find causes of illnesses? And how can you have an exciting and rewarding career helping to save lives and cure diseases? So consider a career in clinical laboratory science. In other countries, we are referred also as clinical laboratory scientists. So there are several reasons on why um, a person can choose, okay, or may choose clinical laboratory science as their profession. Okay, so what we do in the laboratory is that clinical laboratory professionals, we analyze blood, body fluids, tissues, and cells to determine the presence or absence of diseases. Okay, and doing so, we use laboratory techniques and procedures. Okay, so they are highly skilled in the use of latest in biomedical techniques and instrumentation. So take note, guys, that not all medical technologies are skilled in this one, because um, there are, okay, medical technologists wherein they still use manual methods, okay, instead of automated methods, because it is within the capacity of their employer, right, to provide automated machines. And in far-flung areas, okay, so what they do is that they use manual methods. Okay, may mga ganito pa, gumagamit ng manual. Later on in your hematology or clinical chemistry, you will be able to differentiate, or um, yes, differentiate the different methods, automated and manual methods, especially for hematology. If you do a manual counting of the red blood cell or white blood cell, it will take you a lot of time and effort. Okay, so 1 hour, 2 hours for 2 to 4 samples of blood for the CBC. Okay, if you do the manual method, unlike in automated, you only place the sample on the machine, bahala na siya, and then results will be yielded after just few minutes. Okay, so they are highly skilled in the use of, so important works of medical technologists or scientists. Clinical laboratory professionals are vital members of the healthcare team. So we are important. Okay, we contribute an important part in the healthcare. Okay, of course, because what we do helps them in diagnosis and treatment of diseases. But guys, take note ha, we as medical technologists, we are important in the healthcare team. Okay? But it doesn't mean na may mas importante sa atin, or tayo yung pinaka-importante sa hospital. Okay? In healthcare, we work together. Hindi importante kung sino yung mas mataas yung contribution, ganyan. Okay, si nursing mas maganda kasi sila yung kasama ni patient, ganyan. Hindi, mas maganda si medtech kasi sila yung rason kung paano nalalaman yung diseases. It doesn't work that way, guys. Okay, we work together to promote health in general, to make the life of our patients easier, to prolong their life. We work as a team and not as individual profession. Okay, we coexist together. Okay, pare-pareho tayong importante sa hospitals, sa clinics, or sa mga pasyente. Okay? Because what we do contributes in the promotion of health, even for doctors, okay? So, yun lang kasi ang mali sa atin. We compare medtech, we compare nurses, okay? I think, guys, it's not comparable at all, okay? Don't compare different profession. Mas mahirap si medtech, mas mahirap si nursing, okay? Hindi pwedeng ganun. Hindi dapat ganun. Why? Because we have different lines of work, okay? So, nurses, they focus on bedside care. Okay? So, they take good care of the patients. Okay? Unlike us, what we are assigned to medical laboratory technologists, okay, or medical technologists or clinical laboratory scientists is that what we provide is laboratory test result that will help the physician in the diagnosis of diseases. Okay? So, you should never compare or don't compare, guys. Okay? What we do from what nurses do or what respiratory therapists do or what pharmacists do. Okay? Because we have different lines of work. What's important is we help, okay? We help in the promotion of health. We help our patients, okay? Kasi this is one of the issues in our profession, okay, as compared to other profession. Nagko-comparean kasi. What we do not realize is that we contribute in the healthcare delivery system, okay? Up to take note of this one also, up to 70% of physicians' decisions regarding patient diagnosis and therapy are based on laboratory test result. So, guys, I want to emphasize that not all physicians are directed to have their blood or have their body tissues or have their body fluids tested in the laboratory. So there are other ways wherein physicians diagnose patients, like for example, signs and symptoms, X-ray, MRI, CT scan. So the laboratory or the diagnosis is not only about, this is not contributed only by the medical technology profession. Okay, so there are other sources of information for the diagnosis of diseases. Hindi lang po tayo yung nagko-contribute dyan. May mga radtech pa. Okay? So, meron pang marami pang ibang profession that help in the or that aids the physician in their diagnosis. Modern medicine cannot function without clinical laboratory professionals. But this is true, guys. Okay? Modern medicine cannot function without the help or the aid of medical technologists because we provide a very vital information in the delivery of healthcare system. Paano mo malalamang may leukemia kung walang medtech? Paano mo malalamang may anemia? Even sa cancer, okay? So, we also contribute sa diagnosis ng cancer. Okay? So, in the preparation, just like in histopathology, okay? Sa mga biopsy, okay? So, we process the samples for the doctors to see or to diagnose the tissues, okay? Kasi later on, you will see in large hospitals and large clinical laboratories, we process the tissues. So this is covered under histopathologic techniques. Okay? So we process the sample tissues, okay, until such time that is placed on the slide and that is viewable under the microscope. Tayo yung gumagawa ng mga laboratory procedures na yun. Ang gagawin ni doctor is, of course, yung most important part read the tissues that is placed on the microscope, and then they will do the diagnosis. Okay? Pero kung wala din tayo, hindi mailalagay yung tissues dun sa samples. Mga ganung bagay. So, what we really do is really essential. It's essential. It's important. Okay? In modern medicine. So, there are different career opportunities for medtech. Okay? So, we are actually in great demand. Okay? Guys, take note, what we do is in the laboratory is really difficult because we deal with various body fluids. Kahit nga tae, kahit sputum, di ba? Mga sobrang duduming body fluid, mga sobrang duming waste. Okay? So, yan, tae, ihe. Okay? Sputum. Vaginal discharge. Okay? Discharge from the penis of an individual. Bacteria, di ba? It's actually dirty. Don't expect it as a sophisticated, as a sophisticated branch of medicine. Hindi lang po ganun. Actually, what we do is madumi. It's dirty. We do the dirty work. Okay? Bakit siya dirty? You deal with body fluids that are potentially infectious. Okay? They are hazardous. So, imagine mo, you will process sputum, di ba nakakadire? You will process a very odorous fecal material, okay? Or vaginal discharge, okay? That's why, ma'am, what you are saying is not actually related to this one. Clinical laboratory professionals are in great demand. So, guys, let me finish, ha? In many countries, we are in great demand. Okay, even in the Philippines, but not only in our country. Bakit sobrang demand ni medtech? Mataas yung demand. Bakit ang daming nag-a-upload na medtech? Because in other countries, they do not want this work because they see that it's a dirty work in the hospital. Okay? Marami tayong ginagawa na actually mahirap intindihin, di ba? Ikaw ba naman, mag-process ka ng tae, ilalagay mo sa slide, okay? Check mo sa microscope, or sputum, di ba? So, why is it that clinical laboratory professionals are in great demand? Because you contribute in the healthcare delivery system. Okay? So, we are essential in the healthcare team. And, as you can see guys, with the pandemic, especially nowadays, we are in great demand. There are a lot of medical conditions, or there are a lot of diseases already that requires the input of medical technologies for them to be able to identify. Okay? Para malaman kung ano yung sakit, kailangan yung input ng medtech. Kailangan ng laboratory test result. Just like in pandemic. Why is it that we are in great demand at this time? Because what we do, okay, will yield to the determination if an individual is positive or negative for COVID. Malalaman lang nila na positive or negative ang isang pasyente na COVID kung itetest yan ng medtech, di ba? Okay? Especially if that is through RT-PCR. Multiple employment opportunities immediately after graduation. So, we'll discuss this on the later part. Okay, kung ano yung multiple opportunities. Flexibility in working hours and shift. Not all, guys. Hindi lahat. Hindi sana all. Okay? 8 hours yan. Actually, it's not so normal. We as medical technologists, we have a very different working hours and shift. Kasi may night shift pa. We work also on holidays. Highly versatile skills that translate into an unlimited choice of practice settings. Yes, this is true, guys. So, you can work as a microscopist, okay? You can work as phlebotomist, An excellent background in careers in research, medicine, and biotechnology. Yes. Okay, that's why there are a lot of medical technologists who works in the field of research as well. So where do clinical laboratory professionals work? Sa hospital clinical laboratories. Of course, as medical technologists, this is the most common. In physicians' office laboratories, okay? Kasi there are clinics that they have their own laboratories also. Commercial or reference laboratories. What do you mean by commercial or reference laboratories? Um, they do the reference test more advanced. These are the more advanced laboratories. Remember, there was a time in the pandemic. Ito kasi yung kaya kong ibigay muna sa inyo ng example that you can relate. Okay? So, before, they cannot um, release the positive test result if the sample is not tested in the RITM. Kasi RITM, that is a reference laboratory. Okay? So, sila kasi yung nagkakandak ng reference test for microbiology. And when we say reference methods, these are highly specific, these are highly sensitive methods. Okay? If there are doubts in the laboratory test result, it is confirmed by the reference laboratories. In public health laboratories as well, okay, sa mga laboratory, mga hospital, government, or even sa RH2, okay, may mga laboratories sa RH2. There are many other exciting employment opportunities, okay. So, other than that, most clinical laboratory professionals work in, eto kasi, these are the most common types of work that we do. But there are other career opportunities. So we can work in pharmaceutical and chemical industries because we have knowledge about different methods. Okay. So biotechnology companies, there are medical technologists who work in machine providers. Okay. Sa mga machine providers sila ng, for example, this machine is used for CBC analysis, for cancer antigen analysis. Okay, mga ganyan. For the determination of hormones. So, medical technologies work on those companies as well. Forensic and law enforcement laboratories, yes. Okay, kasi nga we do laboratory analysis that can also help in the forensic and in law. In VetMed as well. So, nag-work din, may mga medic na nag-work sa VetMed. Research and teaching institution, just like me. Okay, they are instructors. We are in the academe. Okay, transplant and blood donor centers because we also do we help in blood donation. Okay, we act as phlebotomists. We process the samples, the blood samples. We process them to different blood bags. We separate different components of blood, as well as in fertility clinics, cosmetic and food industry, medical informatics, basic science and cancer research, also in sales, marketing, and product development. So there are medtech wherein they work as sales agent, law and public advocacy as well, and education. Okay, so there are different career opportunities for medtech. You can work as a medtech in water testing station. You can work as drug analyst. Okay. A degree in clinical laboratory science is also an excellent starting point for career advancement. Starting point for career advancement. Okay, you can use the medtech as your pre-med. Okay, kung gusto mong you do further studies in medicine as well as in public health. Okay, biomedical technology, so healthcare management as well and administration. So, who works in a clinical laboratory? So, sino na yung nagtatrabaho daw sa clinical laboratories? Okay, of course, we have the clinical laboratory scientist or technician. Okay, but guys, here, iba kasi yung medical laboratory technician, ha? In our country, iba din yung medical technologist. So, here, we will discuss the clinical laboratory scientist or medical technologist or medical laboratory scientist. Again, we analyzes body fluids for protein, sugar, enzyme, lipids, hormones, and drugs, and many more. Okay, that will provide information to physicians in order to help diagnose, dapat ganyan yan, cancer, diabetes, and kidney disease, drug overdose. So, guys, this is not limited to these diseases. Okay, so it's just providing us examples. Okay, so when we analyze our body fluids as well as tissues, I know pala, we do not, yeah, blood is a connective tissue. Yes, we also analyze tissues. Okay, so not only body fluids, kasi even si blood, di ba? Si blood, we analyze blood for, we conduct also laboratory test in the blood. Okay, we also view them under the microscope. So it detects and identifies disease-causing bacteria and parasite. So this is under bacteriology and parasitology. And then in the result, you will state there, so what is the cause of the bacterial infection? Lalagay mo doon, staphylococcus ba? Or parasite pa? Ascaris ba yung nakita mo sa stool? So ilalagay mo yun sa test result. Determines the best antibiotics. Yes, guys. True. Okay? So, through antimicrobial susceptibility testing. So we determine if um, the antibiotic is still susceptible or resistant. Okay, kasi kung resistant na siya, dapat hindi na siya ginagamit dun para mamatay yung bacteria. Okay, but it's not us who place the prescription. It will still be the doctor. Sila pa rin yung magpe-prescribe. Examines and count blood cells to detect abnormalities like in anemia, leukemia, and infection. Okay? So, nagpa-blood counting tayo. Okay? So, if that is automated, of course, with the help of machines. Okay? But if that is a manual blood counting, and that is us. Okay? And the microscope and other materials. Analyzes blood to find the causes of abnormal bleeding or clotting through bleeding time, clotting time, or prothrombin time, and activated partial thromboplasmin time. So actually, this is specific. Ini-specify niya kung ano yung mga pwede natin gawin sa lab. Test plasma to monitor therapy with anticoagulant drugs. Okay, so ganun din sila APTT, CPT, prepares red blood cell, platelet, and plasma for safe transfusion. So this is under, so this one, guys, this is under clinical chemistry. So this under bacteriology. So this one under parasitology. So these are under microbiology. Even this one under bacteriology. This one under hematology. Okay, so I am referring to the different sections of the laboratory. Kasi the different section, there are several classification, or the different tests that we do are placed on different sections. May division siya ng work. So ito sa tawag dito sa hematology din. Test plasma to monitor therapy with anticoagulant. So hematology, this one under blood banking. Okay, in blood banking, it's about blood donation and the preparation of the blood through several components that will be given to patient for transfusion. So this is under immunology. Uses techniques to detect antibodies to streptococcal infections, Lyme disease, infectious mononucleosis, and many others. And this one naman is under molecular biology. Testing of DNA, RNA, and chromosomes to help identify genetic causes of disease, just like for the RT-PCR test. Okay, reverse transcription, polymerase chain reaction, which is used for the testing ng COVID or ng SARS-CoV-2. SARS-CoV-2, which is the causative agent for COVID-19. We can also work as cytotechnologists. So this one examines cell samples on slide to determine the presence of benign or cancerous diseases. But guys, this one, in our country, we don't do this, okay? Hindi tayo nag-examine and we determine the presence because we are not trained to do so. Sa atin, ito is a work of the doctor. Analyzes microscopic cellular changes that can directly affect a patient course of treatment. Even this one, in our country, okay, this is done by the doctor. Assist in the early detection of cancer, examine cells from all body sources taken by swab or fine needle biopsy. Ito, we can do the pap smear, test for pap smear. No, we don't, again, we don't read this one. We don't do this as a medical technologist. But in other countries, a cytotechnologist can do this. Okay? This is just not so common in our country. Kasi eto mga definition na to, these are done by a physician who is trained under laboratory medicine. Kagaya na lang ng mga pathologists. Okay, but in other countries, these are work of cytotechnologists. Medical technology also work as histotechnologist or histotechnician. So, eto kasi, for this specific work or profession as histotechnologists, these are medical laboratory scientists that works in histopathologic department or histopathologic section, wherein what they do is they focus on processing tissues or body fluids to be placed in a slide that will be read by the pathologist. Okay, sections, stains, and analysis. When I say sections kasi, for example, you have tissues that is cut into small thin pieces, okay, and placed in a slide para mabasa ni pathologist. So it allows the pathologist to determine if disease is present in the tissue. So this one, phlebotomist. So we as medical technologists can also work as phlebotomists. When you say phlebotomist kasi, their main duty is about blood collection. Okay, phlebotomist ka, magko-collect ka lang ng blood, ganun. Most of the time, yes, that is the main, okay, definition of the our work, or that's the main work of a phlebotomist. It's about blood collection. If you are a medical technologist in the laboratory, but you are only tasked to do blood collection, okay, you are regarded as a phlebotomist. So, hindi ka nag-work sa laboratory. You don't do the clinical laboratory analysis for urine, sputum, or sample. So, if this is only your definition of work or your course of work in your uh, in the hospital you are working from or in a clinic, then you are regarded as phlebotomist, tagakuha ng dugo. Okay? So, kung yun lang yung ginagawa mo, you are regarded as phlebotomist. But if you also work in the laboratory, then you are medical technologist. But by profession, kung passer ka naman ng medical technology, licensure examination, you are regarded as medtech. Pero yun nga lang kasi, eto kasi is in your work setting na. Even if you are medical technologist, okay, if what you do is only blood collection, you are regarded as phlebotomist sa place of work mo, okay? As if phlebos, I am phlebotomist, ganito, ganyan. At masteral or doctoral or MD level, okay, medical technologist can become a pathologist. Guys, si pathologist, this is a doctor with a specialty about laboratory medicine. Mga doctor talaga sila. Okay? So, graduate sila ng medicine. You can be administrative director, manager, technical supervisor, laboratory information specialist, or quality assurance coordinator. You can also be a point of care, POCT coordinator. So, ito yung mga tests that are conducted beside the patient. Bedside testing, sabi nga nila, for point of care. Marketing or outreach coordinator, clinical laboratory professionals. So, those guys are the career opportunities for medtech. hindi lang kasi na-mention dito, there are other several career opportunities. You can work on sa research, sa water testing laboratories. So, sa water testing laboratories, these are the laboratories that focuses on testing the water quality. If there are fecal coliform present, ganyan, mataas ba yung bacteria, mga ganun. Another is that you can work as drug analyst. Okay, so if you remember, before there's a requirement that prior to getting a license, an individual must be subjected to drug testing. Okay, the individual must be subjected to drug testing. So yun yung mga drug testing center. Okay, sa drug testing center. So, clinical laboratory professionals, they enjoy the challenge of science theory, laboratory discovery, technology, and medicine. They have a high level of responsibility and commitment to help others, and they have a capacity for calm and reasoned judgment. Yes. Okay. So, aside from that, we are organized, efficient, and problem solvers, communicators, and team players. We have a high standards and demand quality performance and accuracy. We have a highly versatile skills. We solve medical mysteries. We provide vital information to save a life and cure a disease. Okay, so actually I just tried this, but through the discussion, na-mention ko na to or na-discuss ko na to. Okay, so we enjoy the challenge of science, technology, laboratory, discovery, technology, and medicine because this is about the combination of this. Okay, so si science theories, si lab discoveries, si technology, and medicine. Okay, so we have a very high responsibility because what we do is very important in the diagnosis. Kung nagkamali ka ng nilagay na bacteria, nagkamali ka ng nilagay na resulta, that may endanger the what do you call this one? The lives of our patient. Okay, you have a high capacity for calm and reasoned judgment. Okay, this is very important in working, especially sa mga machines. So, the laboratory test result is not so normal. Okay, most of the or all of the test result for bilirubin in that day is abnormal. Okay, so will you release them in that way? No, you have to go back with your quality control. Kasi bakit lahat ng test mo for bilirubin is mataas? Okay? You don't resort on the machines only. You also need to have a reasoned judgment. Bakit lahat abnormal? Okay? Something is wrong with the machine in that way. Okay? So, yun. Versatile skills, medical mysteries, ganyan. Okay? So that ends our discussion for the lesson 2. Okay? And thank you so much for listening. Do not forget your learning assessment. So you explain that comprehensively. Okay? So, wag kasi yung mga you just cannot explain what we do in the laboratory in 5 sentences only. Okay? Or especially this one, ang tinanong is, what do they do in their jobs? Hindi lang siya sa laboratory. Okay? So, wag ganun. Wag lang 5 sentences or 3 sentences. You explain more and what you do, hindi naman kailangan sobrang dami na 1 page na yung sagot mo. But it's not relevant. Okay, yung iba sobrang daming sagot. But it's not relevant to the question. Yung iba, i-define pa yung medtech. But it's not relevant to the question. So, ganun po. Thank you so much for listening. And you will have a quiz next meeting. Thank you.